Coming up on Healthy Living, quality care for kids. Find out how Essentia puts a special emphasis on children and their health. Plus, meet a special group of parents who are helping to guide the future of pediatric care. Then, learn how Essentia Health is ready to help kids after a traumatic accident, including an ER designed just for younger patients.
Your health questions answered. Welcome to Healthy Living, brought to you by the experts at Essentia Health.
Good evening and thank you for joining us. I'm Michelle Lee. Keeping our kids healthy and thriving, it's the goal of every parent. It's also the mission of Essentia Health Children's Services, which offers a wide variety of specialty care tailored just for young patients and their families. Tonight, we'll talk more about the kid-friendly care offered at Essentia. Working to meet the unique needs of children and their parents is part of a special philosophy at the healthcare system. It's called Patient and Family-Centered Care, and it guides how caregivers interact with children and their parents. We are joined now by Dr. Rahal Aggarwal, a pediatric specialist at Essentia Healthcare, St. Mary's Children's Hospital, and by Amy Vanderscheuren, who's in charge of the Patient and Family-Centered Care program. Thank you both for joining us tonight.
Thank you for having us.
First, Amy, what does Patient and Family-Centered Care mean?
Patient and family-centered care is really an approach to health care that engages both patients and families as partners. And in pediatrics specifically, it works with parents, involving them in decisions about the care of their children and respecting the value and knowledge that they bring about their children to the table.
Absolutely, and who knows better than parents about their kids?
Children, yes.
Absolutely. Dr. Aggarwal, why is this philosophy so important?
Well, let me go back several years ago, especially the hospital setting and acute care setting and the ICUs, where patients, family members or friends, nobody was allowed to come in the hospital. They had very restricted hours. They were could visit for 2 hours or 3 hours a day. And when I came to St. Mary's Children's Hospital about 24 years ago, we changed the philosophy and said, no, this is not right. After all, it is a joint partnership between parents, families, us, that we need to have. So I think there's a change in the shift. There's a change because there's a horrendous amount of studies, there's a tremendous amount of studies which shows that the patient outcome, the length of stay, everything is decreased. The outcomes are much better if we allow the patient, family, and friends to be there.
Mm-hmm. And you've seen families and the children respond to this?
Very much, very much. They just love it.
And Amy, can you give us some examples of how this philosophy is enhancing the care at Essentia?
Sure. One of the changes that has been made as a result of feedback and input that we've received from our parents is that now families are involved in bedside care rounds in the hospital. So families are able to participate in that process as their children are being assessed by their care teams. The Starlight Cafe, which is in the hospital, is also influenced by parent feedback and participation.
Interesting. And how did that happen? Or what did they wanted a variety of
food for their children, what their children would eat, and the opportunity to go and get a snack when they were hungry rather than waiting for a certain time to eat.
And especially when we're dealing with children and they can be so impatient, that had to be a big help.
Right, absolutely.
Now, Dr. Aggarwal, how does this benefit your patients? Are families noticing a big difference now?
I think so. I think we have also implemented certain other programs, like example, parents present during induction of anesthesia. So when the kid goes for surgical procedures, they are there before the kid goes to sleep. We are also implementing parents present during radiological procedures. So we want them to be partners with us. We do not want them to be sitting out and not participating in the care. So I think that's the thinking they've changed. We want the parents to be there, be with us, provide the care along with us. Mm-hmm. So it's really benefited the parents. It really benefited the kids. The anxiety levels for both the parents and the kids have gone away. I mean, this decrease is not completely gone away. We are using less amount of pain medications because the parents are there. So there are a lot of benefits in doing that. We have shown that there's a decrease in length of stay for these children, when the parents are there.
That's very fascinating because when you think about ill children, I'm sure there's a lot of stresses even for the little kids. And anything you can do to reduce that is going to speed healing.
Absolutely, absolutely.